Welcome to the Home Healthcare Today show. I'm your host, Dr. Cleman Moore. It is National Nurses Month. And for this special episode, we're going back into the vault. 4 years ago, I interviewed Dr. Randolph Rasch. Dr. Rasch is the first African American male to receive a nursing license in public health in the state of Michigan. He is a great influence and inspiration for my current pursuit of a nursing license. Tune in, you won't want to miss it. Our guest on the show today is Dr. Randolph Rasch. Dr. Randolph Rasch is a professor and advisor to the Executive Vice President for Health Sciences at Michigan State University, and he is leading a university-wide effort to foster sustainable health, a pillar in the university's strategic plan in communities in the state of Michigan. Dr. Rasch has over 30 years of experience teaching in BSN, MSN, DNP, and PhD programs in nursing. He has published and presented in the areas of primary care, HIV risk reduction, and diversity in healthcare education and clinical practice. Prior to his current position, he was dean and professor of the MSU College of Nursing from 2015 to 2021. Previously, Dr. Rasch was chair of the Department of Community Practice Nursing in the School of Nursing at the University of North Carolina at Greensboro, and the director of two well-known family nurse practitioner programs, one for the Vanderbilt University School of Nursing, and the other was the School of Nursing at the University of North Carolina at Chapel Hill. Dr. Rasch was the first statewide Director of Nursing Services Program Director in the Tennessee Department of Correction. And he led development of the Quality Assurance Program for Health Services. Working with another Vanderbilt alum, Dr. Rasch co-designed and implemented a system of healthcare for the Tennessee Department of Correction that had not existed prior. He's a fellow in the American Association of Nurses Practitioners, a distinguished scholar and fellow in the National Academies of Practice, and a fellow in the American Academy of Nursing. Among his firsts are the first African American male graduate of the nursing program at Andrews University, located in Berrien Springs, Michigan. The first African American male master's prepared family nurse practitioner. Dr. Rasch is a graduate of the FNP program at Vanderbilt University School of Nursing. The first African American male to hold the PhD in nursing, and the first African American male public health nurse in the state of Michigan. Among the many honors he has received are Distinguished Alumni Award from the University of Texas at Austin School of Nursing, the Lulu Wolf Hasenplug Award for Distinguished Career in Nursing from Vanderbilt University School of Nursing, the Dr. Gene Tranbarger Writing Award from the American Association for Men in Nursing. Dr. Rasch, welcome to our show.
Good to be here.
Yes, sir. Dr. Rasch, what an impressive background that you've had in academia, in public service, as well as the field of nursing at multiple institutions. Dr. Rasch, tell us about you. Tell us about you, growing up, your passion for nursing, students, and public service.
Well, I grew up in Michigan originally. I'm from Michigan originally, since we're on video, this part of the state, southwestern part of the state.
Uh-huh.
I grew up way out in the country, and I only went to religious schools all my life because I was raised as a Seventh-day Adventist.
Yes.
I went to a little one-room schoolhouse out in the country, and then Andrews University Academy and Andrews University. And I think growing up, probably I was interested in healthcare just because I had that background and we were sort of inculcated with the idea that you serve.
Yes.
But I was also very much interested in art. So I could draw, I could paint,
Uh-huh.
I could sculpt, and never been trained in any of that.
Yes.
And sort of quit doing it when I decided to become a nurse.
Mhm.
I originally thought I would be a physician,
Okay.
but when I was in high school, our guidance counselor was a nurse, and he happened to be a nurse anesthetist. And I said to him, um, if I wanted to become a physician, but I became a nurse first, could I do that? And he said, yeah, you just have to get the prerequisites for medicine. So I went into nursing. And fortunately for me, at Andrews University, nursing started in your sophomore year.
Okay.
So I really didn't know that much about nursing. I just knew what most people probably know. And I started and I thought, well, I like this well enough.
Yes.
I'll stay with this. So it really turned out to be the best thing and probably more of what I wanted to do in healthcare than be what a physician typically does.
Okay.
And so that was exciting. I think some years ago, maybe 10 or 15 years ago, my colleagues started saying to me, we didn't think you were ambitious, but we've learned who you are. And I said,
Uh-huh.
first of all, why are we talking about my ambition?
Right, there you go.
But tell me what you're saying.
Uh-huh.
And they said, you've been socialized to serve.
Mm.
And I hadn't thought about it before, but because of where I went to school, no matter what your major was, we were socialized to serve.
Yes.
It was religious school. We weren't socialized to proselytize.
Right.
We were socialized to serve.
Yes.
And so that has been a guiding thing for me in everything that I've done.
Very good.
I worked in the hospital. I liked working in the hospital, but I was 21 years old and it was night.
Night
I worked
shift.
at nights,
Yes.
and I was like, okay, I've had enough of this.
Yes.
So one morning, I went over to the health department and interviewed, and drove the 30 so miles or so because I still lived at home. Went to bed, and they called and talked to my mother, and she said, "Well, he's asleep, but I'll have him call you." So I called him, and went into work, and then the next morning went into interview, and they hired me. And it probably set the tone for the rest of my career.
Yes.
So one of the things I say about nursing, when we're doing what it is that we should be doing, then what physicians are doing and what nurses are doing are complementary,
Yes.
right?
Mm-hmm.
So we shouldn't be trying to replace each other.
No.
And what nurses do is we focus on who you are.
Yes.
Who are you as a person? And we don't try to change that. Whatever your health status is, whatever your medical care is, we try to work with you so it has as little impact on you as possible. Because if you radically change somebody's diet or exercise, they'll do it for a little bit, but they're not going to do it.
Right.
So I always said to students, who knows what comfort food is? And they'd raise their hands. And I said, so when you're working with patients and there's a diet piece, find out what they eat and how can they eat that in a more healthy way because they're more likely to stick to it. If they need to exercise, don't make them think they need to go to a gym. If they're in the country, I remember one of our students who grew up in the country was working with families, and I said, what are you doing about the exercise? She was in the Army. And she said, I would talk to them and said, who are your neighbors and how far away are they? And they'd tell her and she'd say, so we'll walk down to their house once a day and you've gotten that exercise in.
Absolutely.
So, I think the passion for nursing is really to serve our fellow human beings in that way.
Yes.
So it's doing it as a nurse, which doesn't take anything from doing it as a physician or a social worker or any of that. The other thing I would say to students too is your ability to do the direct care with patients or work with the machines that are attached to patients. And then as I became a nurse practitioner, your ability to diagnose and prescribe are technical skills for a nurse. They allow you to be with a patient to do what a nurse would do.
Yes.
And nurses are educated and trained because that stuff takes training. But the education is how do you think about the people you're providing care for and how do you meet them where they are?
Yes.
And I'll just throw this in because right now, there's a huge thing about DEI, diversity, equity, inclusion, health disparities, and health,
social determinants,
all of that kind of stuff.
Yes.
When a nurse does what it is that a nurse should do, those don't become a problem.
No.
Because you begin to learn who this person is. That includes who they are culturally, all those things. And those aren't problems. Those become resources and richness for those patients. And if you pay attention, it becomes an enrichment for you as well. So I wanted to throw that out because if nurses do that, and it's helpful to learn all of that, but if you do what you're supposed to do, then you will learn that and you will give the care that's appropriate to the person. The other thing I like to say about nursing is I would say to students two things. You'll always have a patient that is ticking you off.
Just a little, right?
And the thing that you do, I had a mantra, and I didn't realize other people had the mantra, but I learned it early, and it was to relax and think, it is not about you. And as soon as I did that, I could move along with patients. But the shocking thing was to have patients come back and request me. I didn't know that, but they would show up and I'd go out and say, why are they here? Because we had a problem the last time. And they said, because they asked for you. So I learned that if you're real and authentic with people, they may not appreciate it in the moment, but it develops trust. And then you can move forward. And I'll tell you how important that is because I learned it in the prison system. So, they'd try to run a game on you. I mean, you'd catch them and say, okay, you are wasting my time.
Right.
And if you wanted to just come up here and talk, tell them that. And if I have the time, we can do that. But you're taking up time that somebody else could use.
Yes.
And those guys would laugh and go, oh, you caught me. But when they were seriously concerned, those of us who acted in that way, we were the ones they wanted to see. So we're covering a lot of things here.
Yes.
I just said that but those are, you asked me about the passion piece.
Yes.
And the passion piece is to be educated and trained in a way that you can provide, that you can serve your fellow human beings. And in this case, you do it as a nurse.
Dr. Rasch, what were some of those obstacles along the way? And then how did you overcome it? And then since it's National Nurses Month, how can we encourage other youth to pursue the field and to overcome some challenges?
It's interesting because when I get that question, it's always difficult for me to answer. So I was talking to my brother and I tell people that I'm an introvert and they go, yeah, right. On a Myers-Briggs, I rate as an introvert.
No.
But it's because Myers-Briggs is based on Jungian psychology. And Jung defined an introvert as someone who renews their energy by being alone. And an extrovert is renewed by being with people.
Right, social.
So people confuse being gregarious with being an extrovert.
True.
So I'm gregarious, but it wears me out. Right.
Right.
But and now I'm forgetting what you asked me.
No, it's good. It's good.
But
yes.
But I think one of the things you do is you're talking about the barriers and obstacles.
Yes, sir.
And so the other thing I would say about that is that I'm naturally an optimistic person, and I naturally believe in my fellow human beings as well. And so it's hard for me to answer the question personally because I didn't see the obstacles. And I know they were probably there,
yes,
but I didn't see them. But one of the things that happened to me is my friend Alexis Steifbergen is Dean of the School of Nursing at the University of Texas at Austin. We graduated together. Yes. And she had me come do the commencement address. And all of the firsts that you mentioned, I've seen them written down and all of that, but I'd never heard anyone say them. And she introduced me and said all of that. And as she said it, something occurred to me that had not occurred to me before. So when I got up, I said to the students, well, you heard Dean Alexa say all these first. And I said, and as she was saying it, I realized I'd never heard anyone say it. And the thing that's important to know then is I was the first African-American male in all those places in school, but I was educated by white women. And what I appreciate, and it's something that we can all learn, is I realized looking back all these years at that time when I was telling the students, that's not how they saw me. They saw me as Randy.
Yes.
And I said, I can look back and see that I drove him crazy. And they would go, okay, let that one go. I remember, I wear a size 6.5 shoes, so I couldn't find white shoes. So I ended up getting navy shoes. And then I got sick of them. So I would wear them, but then I started wearing brown earth shoes. I remember going in one day in my uniform as a student wearing blue suede Spectators. They were dark blue and they never said anything. But another thing that happened was one of the styles was back then, this would have been the 70s, because I was following GQ too.
Sure.
You'd wear a suit, and there was one time where you would wear a ski cap over, a knit ski cap. It was the style. You dress in a suit, whatever, and you wear a ski cap. So I decided to wear a white one. And so I got on the floor, and the nurses said, I don't know how I answered them, but I know I didn't lie. But they said, "Oh, you're wearing your nurse's cap," and I just sort of smiled and whatever. And so when the faculty member came down, she was standing beside me, and she said, "What's with the hat?"
Yes.
And one of the nurses said, "Well, isn't that his nurse's cap?" And she looked at the nurse and said, "The men don't wear caps. Take it off." So I took it off. But I look back at them, and so I give the example of they didn't only treat me that way.
Yes.
There were two other guys in the program. One was from China, one was from India.
Yes.
But whether we were men or women, they treated us as who we were.
Yes.
And so I can look back and see that there may have been barriers, but I didn't experience it that way. But having said that, once I left that cocoon,
yes.
and in it, I could see how people were being treated in clinical and all those sorts of things. So, my advice to how you meet those obstacles, the very first thing is to know who you are. Know who you are, know what you're gifted to do.
Yes.
And then begin to learn from people how to deal with that. And sometimes it's how to actually say to somebody, this is how you're treating me.
Yes.
You may not realize it, but here's how it's affecting me. How can we move forward? But the other thing is to learn what the systems are like, what the systems do.
Yes.
One, to do the barriers, but what is built into the system that helps you overcome and deal with those things.
Yes.
And the other thing is, Wintley Phipps is a singer. My brother and sister-in-law know him pretty well, but he said to my sister, he said, "You need to learn my mantra." She goes, "Okay, Wintley, what's your mantra?" He goes, "Don't stay where you're tolerated, go where you're celebrated." If that's what it is, we train and socialize people to think, oh, stand up and be there and blah, 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 blah. No, get the H out. If you can't change it,
right.
And if you're being abused and all of that, don't stay. Learn from it and go someplace where they are welcoming you to do that. But let them know about it before you leave. Here's what you did. Here's how it affected me. And don't tell me about DEI because you're just giving lip service to it. You're not really doing it.
How vital do you believe, in all the various tracks that students can take from a number of different backgrounds, whether it's rural or urban or, faith-based backgrounds, how important will health careers be in the mid-21st century?
Well, they continue to be extremely important.
Yes.
So I'm a Trekker, and I also like Star Wars.
Okay.
But if you look at Star Trek from the 60s, and I didn't look, when it was on, I didn't see it, but when I was in the PhD program it was running, I would go home from class and I would turn it on and watch it. But one of the things that you remember in there was sick bay.
Yes.
So there's all of that there. You think it's because of what health means, and it's bigger than just the absence of disease. It's wellness, all of that
Yes.
kind of thing. It's you mentioned the social determinants of health,
Yes.
finances, all those things
Mhm.
affect our health. And we especially know it in minority communities,
Yes.
but it's in other communities too. Wealth can be a social determinant of health, and we look at it in a positive way,
Mm.
but it's not always as protective as you think.
Mm.
So health is always going to be something that we're living with. If you look at Star Trek, and the thing that I think nurses need to think about, and it's something we need to think about in education, it's always going to be important. How we do it is going to change.
Mhm.
But the rule of thumb, the thing I always said that I said before is we are here to serve our fellow human beings.
Yes.
But we're also here to be scholars in
Yes.
serving our fellow human beings. So that's the importance of education.
Yes.
How do you think, not just how you train?
Yes.
When you focus on training, those things that you train people to do may last for a year. And if it changes, how do you, so you're looking at technical skill.
Yes.
Technical skills aren't difficult to learn, but how you learn to think about your fellow human beings, how do you learn to care for them
Yes.
is going to be the rule of thumb. And then how do you continue to learn?
Mhm.
So the future is here. So I brought up Star Trek because the National Institutes of Health is a place that we do research to look at what is the cutting edge thing that we need to do for care for human beings. And more recently, in the last few years, we've had, I'm so proud of this, nursing scholars who are at NIH doing research that infuses nursing. One of the ones is looking at closed head injuries with
Yes.
athletes.
Mhm.
And she's doing stuff that's technical that you think is medical and all of that, but she's also using it to say, and how do not only other health professionals use this information, but how do nurses?
Yes,
I bring it up because if you
Mhm.
look at Star Trek
Mhm.
and they're traveling where, where no one's been before,
Yes.
and the mission and all of that. So they're always exposed to different illnesses and things.
True.
And what you see in sick bay is a mini NIH. And what you see is the physician and the nurse having access to all kinds of information and thinking about it
Wow.
in these ways because they can't wait for NIH to do something. They have to solve it then.
Right
And
there.
if you watch those shows that focus
Yes.
on that, the
Yeah.
solution comes from looking at all that then, thinking about it, and coming up with something to deal with it right then. And then they can share that information.
Yes.
So I think this is important because nurses tend to bow at the idol of research.
Yes.
And then we say stupid things like the PhDs develop knowledge and the clinicians apply it. Well, who says that?
Who says that?
We need
Right.
to get over it.
Yep.
So a clinical scholar, a scholar learns the information. I'll give you two examples. So how do clinical scholars do this, right?
Right.
But the process is all the same. And the process is looking for patterns.
Yes.
So if you only learn to look at this patient and then this patient and this patient and don't see that they're patterns,
Yes.
then you don't develop that knowledge. So a very concrete example, I hate giving it because
okay.
it's drugs,
Please
but
do.
it's a concrete example. Off-label uses of drugs come from that. So there was a drug, Wellbutrin, which was for depression, and now it's also Zyban, which is for smoking cessation. Nurses should have figured this out if we're looking at it and paying attention. So what happens is someone's depressed and you prescribe Wellbutrin for them, right? Not true of all depressed people, but a lot of times some of them may be smoking a lot.
Yes.
The clinicians notice, wait a minute, these people aren't smoking as much. And as they put it together, the only thing that made sense was the Wellbutrin. So they started prescribing Wellbutrin for smoking cessation, right? And it worked. It's an off-label use of drugs. The reason it's called Zyban for smoking cessation is that the health insurance companies, if you were prescribed Wellbutrin, said they're really depressed and you're treating for depression, but you're not putting the diagnosis because it makes your premium go up.
Yes.
So it was worth it to the company to do the clinical trials for smoking cessation, and that's why it says Zyban.
Gotcha.
So I give it to say what it means is that The way you develop knowledge is you look at patterns.
Yes.
And if you're a clinician, you're looking at these patterns and you go, what do those mean?
Yes.
If you're a scientist, you do it the same thing. You're looking at patterns, but you're gathering data, right?
Mm-hmm.
If it's a lot of data from a lot of different people,
Yes.
the way you analyze it is through statistics.
Yes.
If it's qualitative, you do it the way the clinician does it. You go, what are these themes? What do those mean? What is it? So we need to give clinicians that piece. So I'll give you one example from nursing. I remember reading it, but I can't find the reference. So now I say it may be apocryphal. But years ago, when they first started neonatal care for premature infants, the perspective, what the approach was to look at the gestational age. When would this child have been born? And so the care was based on, they did certain care, and when they would have been the time they would have been full term, they progressed the care. And this was happening, and the nurse was progressing the diets. And she progressed the diet on this one baby, I think it was a boy, and this little red flag went up. It doesn't have to be a little red flag, but it has to catch your attention. Yes. So the little red flag went up, and she didn't think anything about it. But that baby started going bad. I think he made it, but he started going back. Well, she remembered that. And she pulled his chart and looked at what his condition was before his diet was progressed and after. And so she noticed that it changed. So then what she did was proactively, as a clinician, started making observations. So she started looking at all the babies to see what happened. Yes. And what she found was it didn't happen to all of them, but there was a significant number of them that their condition changed. Yes. And then she did what nurses always do, because we haven't educated them to be able to do it themselves. Yes. She told it to a physician who figured out two things that nurses should have known already. The first thing is, remember, we care for individuals. So don't have a uniform approach to everybody. Yes. Pay attention what this is. But what the physician also figured out is you pay attention to growth and development of each one. And that's how you do it. So you go to a shoe store. This is from a book of logic that I used in my dissertation. Yes. You go to a shoe store and you buy a pair of shoes. You get great wear out of them. You go back to that shoe store. You get great wear out of those. Those are reasoning from analogy. It can be, well, I got great wear because I bought them from this shoe store. Or maybe I got great wear because every time I bought them, I bought Bass Weegens. Right. So there's a way of thinking about it, but then you can test it. Once you do that, you can test it, and that's the deductive testing.
Every Saturday at 10 a.m., we bring the Home Health Care Today show, hosted by Dr. Cleamon Moore and sponsored by Meridian Health Plan in Michigan. We bring health and wellness topics straight to you. Tune in at 10.